Hello guys. Welcome back to your favorite channel, Talk of Today. I'm your host, Zee Zaman, and I'm truly honored to have you with me. How are you all doing? I hope you and your families are healthy, happy, and safe. This series is about the top 10 major problems faced by elderly people in Europe, the ones who built our countries, raised generations, and gave their best years to society. In our first episode, we discussed the emotional and deeply painful topic of loneliness and social isolation in old age. But today in episode 2, we'll talk about an issue that's not just heartbreaking but life-threatening. Limited access to healthcare for the elderly in Europe. Let's dive into this important discussion. Syringe: the harsh reality. You may think that Europe, with its advanced hospitals, universal health systems, and modern technology, must be a healthcare paradise. But for many elderly citizens, the reality is completely different. Even in countries like Germany, France, Italy, and the UK, millions of elderly people are unable to access timely and proper medical care. Here's how. Booking a doctor's appointment is a struggle. Hospital waiting times are extremely long. Public transport is limited or unavailable for seniors. Many services are digital only, and older people are not digitally literate. On top of that, a shocking number of elderly people live entirely alone, with no one to help them book appointments, understand prescriptions, or even take them to the hospital. Real problems they face. Let me break it down further. Digital barriers: most health systems have moved online booking appointments, viewing test results, and even video consultations. But many elderly people don't know how to use smartphones, apps, or websites. Mobility issues: they can't walk long distances, have no cars, and many cities have poor public transport for seniors. Overburdened health systems: even when they get an appointment, it's often weeks or even months away due to the backlog in many public health systems. Language and communication gaps: immigrant elders or those with speech or hearing problems often can't explain their health issues properly. Rising costs: in some parts of Europe, while basic care is free, many services require copayments, especially for specialists, dental care, physiotherapy, or home nursing. This puts extra burden on retired people with limited pensions. Older adult Mr. Rashid's story, not just fiction. Let's bring it closer to home. Meet Mr. Rashid, a 78-year-old widower living in a small flat near London. He has diabetes, high blood pressure, and he suffered a minor stroke last year. His children live in another city. He has no nearby family or friends. He struggles to use the NHS website to book appointments. The hospital is 2 bus rides away, and he can't walk to the stop. His phone calls to the health center go unanswered for hours. So, he just waits. He hopes the pain will pass. But it doesn't. His sugar levels rise dangerously. His blood pressure stays uncontrolled. And every single day, the risk of another, possibly fatal stroke increases. And sadly, this isn't just a rare case. There are millions of elderly Europeans silently suffering like Mr. Rashid. Stethoscope: common illnesses in the elderly. As people grow older, their bodies need more care, not less. Some of the most common and serious illnesses they face include high blood pressure. Hypertension often shows no symptoms until it causes stroke or heart failure. Diabetes requires strict monitoring of sugar levels, diet, and regular medication. Arthritis makes walking, climbing stairs, and even dressing painful. Dementia and Alzheimer's, memory loss and confusion can make it impossible for someone to manage their own care. Chronic respiratory diseases, like asthma or COPD, which can turn deadly without inhalers and oxygen support. Vision and hearing loss, making it harder to communicate, read prescriptions, or navigate public spaces. Without regular checkups, medicine, and support, these illnesses can worsen rapidly, often leading to emergency hospitalizations or even early death. Chart: decreasing the dangerous results. When healthcare becomes difficult to access, here's what happens. Illnesses go undiagnosed for years. Medicines are missed. Emergency cases increase. Hospital beds fill up with avoidable complications. Mental health worsens. And ultimately, more elderly lives are lost too soon. According to reports from the European Commission, over 20% of avoidable deaths in seniors are due to delayed or inaccessible medical care. That's not just a number, it's a tragedy. White heavy checkmark solutions, what can be done? It's not all hopeless. There are real solutions that governments, communities, and even families can implement. Bus mobile clinics that bring doctors and nurses to local neighborhoods and rural areas. House with garden home visits by community health workers, especially for bedridden or disabled elderly people. Telephone receiver non-digital appointment systems, easy call-in lines or even walk-in options. Mobile phone training the elderly, workshops to teach them how to use health apps, book appointments, and contact helplines. Automobile transport assistance, volunteer driver programs or government-funded rides to hospitals. Hospital more geriatric doctors, Europe needs more specialists trained in elder care. Eurobanknote better funding for elderly programs, governments must invest in elder-friendly healthcare models. Family man woman girl family involvement, children, neighbors, or volunteers checking in regularly, helping with medicine and appointments. Our elders built this world for us. They sacrificed their youth, raised families, paid taxes, and served society. In return, they deserve dignity, respect, and healthcare. Their health is not a luxury. It's a fundamental human right. Let's not wait until it's our turn to grow old to care about elder healthcare. Let's act now, with compassion, policy, and practical steps. Thanks for watching Talk of Today. I'm Zee Zaman, and in our next episode, we'll talk about another serious issue. Financial struggles and low pensions among the elderly in Europe. If you found this episode informative, please don't forget to backhand index pointing right, like this video. Backhand index pointing right, comment to share your thoughts. Backhand index pointing right, subscribe to stay updated. Backhand index pointing right and share it with someone who needs to hear this. Also, if there's a topic you'd like me to cover in future episodes, envelope with arrow, drop your suggestion in the comments below, I read them all. Take care, and always remember the elderly around you. They need us more than ever. Be happy and be positive.